we oncologic surgeons, and when we treat cancer, we also share your load. I always tell my patients, I'm sharing your load with you and your family. You are not alone in this fight.
A lot of times we just think that physicians are just cold or they're just doing a job. And it is our job. This is something that we do. But what is the feeling for a surgeon like yourself when you receive patients that need surgery? How do you feel personally?
Yeah, Kenny, that's an interesting topic that we were discussing when you were here in Costa Rica. And one of the main feelings that we surgeons carry is sometimes the impotence feeling, because we aren't gods. We are just human beings dealing with all the feelings of, fighting against the cancer.
And if you're wondering, where can you find Dr. Jose Jimenez? Listen, Dr. Jose Jimenez is in the Clinica Biblica in San Jose. Okay, that is a hospital there that you can look up. Hello. This is Kenny Perkins, aka your cancer guy. And again, as always, we're bringing you another phenomenal guest. And listen, this time we travel down to Central America to the beautiful island of Costa Rica. Now, Costa Rica is probably one of the most centralized areas for medicine, and rightfully so. Today we're bringing you one of the top surgeons in Costa Rica. This gentleman is not only a generalized surgeon, but he is a specialist in oncology surgery. And so if you want the best, you are someone who is traveling to get some type of surgical procedure done in Costa Rica, then you want to make sure you look up our next guest, because this gentleman, this physician, this doctor, this man is not only a person who puts his heart on the line for his patients. He is a believer. He's a man of faith. He's a man who takes a holistic approach to treating and surgically removing any tumor or cancer that may be going on within the person's body. And that's the type of person you want on your medical team. So please give me a big round of applause, an honor to bring in this physician, this surgeon, Dr. Jose Jimenez. Dr. Jose Jimenez.
Hello. Thanks, Kenny.
There he is.
Thank you for that amazing introduction. Thank you. It's really an honor for me and a great privilege being here with you and all the people who is watching us and also listening to us, to this amazing podcast and this amazing program you have, that the main goal is to teach others, and not also teach, but also we have to help, because I've also think that cancer patients are special patients. So here in Costa Rica, for us, it's really an honor when you came here and we met. I saw that you have that special sign in treating and helping people, because what's the first thing that comes into your mind when the doctor tells you you have cancer? What's the first thing, man?
A lot of times they believe they're going to die. That's
yeah, Kenny. That's the main thought that comes into your mind. I'm gonna die. So I'm not only a surgeon. I like that people today in the show me can watch, can think, and can have the image of all the persons that treat cancer, and especially me, like a person. I'm also a person who is telling a person you have cancer and you could die of that. Or another cases that we're gonna talk in the show, when we can't operate, when we can't remove the tumor. So it's a very complex issue. So for me, it's an honor having being here as a guest of your program. And thanks a lot. And I hope we can meet again in Costa Rica.
For sure. It's my honor as well. And let me say, you and I being in this profession, we know that at times patients, they come in, it's overwhelming. Anyone that comes to see you, Dr. Jimenez, they've already been diagnosed, right? They've already been told that they have cancer and it's in whatever location that it's in, and that you are the person that needs to remove that. A lot of times We just think that physicians are just cold or they're just doing a job. And it is our job. This is something that
Yeah.
we do. But could you shed some light and help us to see what is the feeling for a surgeon like yourself when you receive patients that need surgery? How do you feel personally about moving forward?
Yeah, Kenny, that's an interesting topic that we were discussing when you were here in Costa Rica. And one of the main feeling that we surgeons carry, it's sometimes the impotence feeling because we aren't gods. We are just human beings dealing with all the feelings of fighting against the cancer. And sometimes it's very difficult for us because sometimes people can come and patients come without the diagnosis of cancer. So I have to tell them, you have breast cancer stage 3, you have breast cancer stage 4, it's metastatic, we can't operate. Or that feeling, Kenny, is sometimes overwhelming for us, so we have to hide it. And we are not cold persons, but it's our job, it's our daily job. So how do we deal with this? It's some like emotional charge, or it's like I'm not gonna think about that, but then you arrive home and you are thinking about your patient. You are thinking about, did I take the best decision by cutting here? Did I do my best effort? I was tired, I haven't slept well night before, I haven't gotten lunch, I didn't get dinner, I was starving, I maybe did the procedure very fast because I have to go home and take care of some issue. It's like a daily, like emotional senses that we have to make our best effort for our patient. So yes, Kenny, that's very important that all the people who are watching the podcast and listening to the podcast have the idea that we oncologic surgeons, and when we treat cancer, we also share your load. I always tell my patients, I'm sharing your load with you and your family. You are not alone in this fighting. And sometimes I tell them, it's not just a fight. You don't just have to fight. You will be by the side with me, and I will be supporting you. Maybe a text message. How did you, wake up this morning? Do you feel all right? Just Friday, I had a patient of 85 years old. She was consulting because she had abdominal pain, and they made a colonoscopy, and the colonoscopy didn't show like a real big lesion, but she was worsening in the symptoms, and then she started with vomits, fecal vomits, and she had colon cancer. So the daughter approached it to me and she told me, like, doctor, is my mother gonna die? So I told her daughter the diagnosis of colon cancer, and I told her, we are gonna make our best effort to remove all the tumor, but I think that she's gonna be all right. And they believe you, Kenny, because you are the one who's telling the patient, or in this case, the daughter of the patient, she's gonna be all right, but they have to trust you. So you carry that feeling outside the OR, then you enter the OR with that feeling. You scrub, you wash your hands, and you are thinking the procedure, the way you're gonna cut the structures, the way you're gonna cut the veins and everything. Inside, you're making your planning of the surgery, and then you enter and you are like, oh my God, please follow my hands, guide me this way or the other. And you are just like getting your best effort, and you come outside the OR, you remove all the tumor. And the best part of being and working with cancer and operate cancer is when you remove it all, and then you come to the waiting room and you tell the daughter everything was just fine. She just hugged me and we cried together, man. That feeling, Kenny, it's like the best part of my practice in surgery. But sometimes we don't have that result. Sometimes we have to tell the patients we couldn't remove it, and that's like the two sides of our practice. But the most important message for me today is like people and that we carry the feeling. I carry the feeling. Sometimes I can't cry because I will cry a lot of times, but I arrive home and I think, like I told you when we met, did I make my best effort? Could I do something different? Because we are human beings, Kenny. We can make sometimes decisions that we try to make our best decisions, that feeling of I really want to help and how can I help, giving the best of me.
And that's the beautiful part about you as a surgeon. You are always thinking about ways to benefit the patient, ways or things that you can do better.
Yeah.
And that's how we get better.
Yeah.
We never just relax on our laurels, right? The things that, oh yeah, it's just, this is how we do everything. You're
Yeah.
always wondering how to get better. And that your patients that are a part of your team, they're going to benefit because of that. So thank you. Thank you for taking that approach and being humble enough to want to be better for your patients. Yeah, thank you.
That's very important, Kenny. I love that word. When we met, I told you, man, I love being humble, because crazy story about one rich man in New York that started his building, and he always salutes the guy who is opening the gate, and he always says good morning, good afternoon, good night. And one night the gate man says, oh my god, he hasn't said me greeting today, something happened, and he had a heart attack and nobody noticed. But the gate man, the gate humble man, the one who just opens your gate of your building, and he called 911 and he saved his life because he was humble, and he said good morning to the vice president just the same as to the gate man. So when you are a bright person, and when you think that you are just a powerful person and you can do everything and you can heal everyone, Kenny, you are wrong, man. You have to be humble. And sometimes in my medical practice, I had to recognize to my patients, look, I did this, but it didn't work. We're going to try this other treatment and second line, third line chemo, or radiation process, or we are going to try immunotherapy. It's all a whole concept of humbleness. And that's one of my main characteristics in my medical practice. You have to be a humble person. I always say good morning to all the guys in the OR, just as to the director of the hospital. So that's one of the main things that I like to be different in my way of working and treating my patients.
Yes. What a gift you are to your patients. What a blessing you are to your patients, because, you need that in the time of being diagnosed. You going into surgery, you're afraid. You're scared. You don't know what's going to happen, this diagnosis. And, so when you have a physician to come in and take that approach and that you do, it makes the biggest difference in the world. Yeah.
Yeah, Kenny, just for example, a hug before a surgery, a hug to your patient, giving the hand, just not only telling them everything's gonna be all right, but also giving that extra mile to your patient.
Yes.
I also had once a patient that she was a very Christian person. She had a very, God, and she carried her little cross and everything. I'm a very Christian person also. And she told me, doctor, can you please make a little prayer with me? And I told her, of course, Mr. Eugene, what's her name? Of course, Mr. Eugene. And that approach of making the prayer with my patient just before the gastric cancer, at the end, everything was just fine, but it made like that final seal with your patient. It was like the last connection he needed for that big fighting the surgery, getting over the surgery, waking up with a lot of tubes in your nose, in your mouth, a lot of pain, that wound and everything. Because, Kenny, and all the patients, all the people who are listening to us, we know that being in the hospital, it isn't a nice feeling. Okay, it isn't a pleasure feeling. Okay, it's just how we have to give that extra mile, give the prayer, give it a hug, putting your hand and just saying everything's gonna be all right. We're gonna make our best effort. So that's very important, Kenny. That's why I'm very thankful to the invitation to the show today, because I like that people know that we can't just treat, I can't just operate. I have to give that extra percentage for my patients. I have to say them everything will be all right with our best effort, and giving that hug, giving that WhatsApp message, giving that Instagram message, how do you wake up today? How are you feeling? And I don't put my secretary to put that, to make that things, because I like to do it personally, to being just the personal attention of patient to the doctors. That personal feeling, the doctor who made me the surgery is responding my messages. Oh my God, it isn't an AI, it isn't a machine, it isn't another person, it isn't the secretary, it's me.
Yeah.
It's me that I'm responding the message of how is my wound, I'm vomiting, is that fine? Sometimes they just tell you, I have cough, is this all right? Some little things that for us, maybe it's nothing, but for the patient, it's a lot. If you have a wound for a breast cancer and it looks like it isn't pink or something, for you, it's the world. For the patient, that wound in the breast or that wound in your face for skin cancer, melanoma, it's your world. Your world is getting apart. So you are seeking help. And if you're a cold person, if you don't tell your patient, if you put a secretary, if you put another one to do that, man, the patient isn't gonna feel the trust or the confidence of Dr. Jimenez is responding my messages. So you can be the best one anatomically and technically, but if you don't have the human side, you aren't nothing, man.
That's why they love you. That's why we love you. You,
Thank you, thank you, man.
yeah, for sure. You put that side, and not everyone does that. And that in itself, it's a lost art.
Yeah,
It's an art when you can put yourself in other people's shoes to
yeah,
understand maybe how they may be feeling. And, this and being empathetic is what we say here. To be empathetic is being able to understand that you're putting yourself in that person's shoes and understanding that feeling. So we thank you for that. And, I want to touch a little bit on that because we're talking about Costa Rica and how medicine is done there. You guys have a social security style system, which is something for the public. And then you also have private, right? So maybe you can explain that a little bit because there's a public side and a private side.
yeah.
And you do both, right?
Yeah, Kenny, for example, I studied in the University of Costa Rica. It's like kind of education that it's public education, and it's like one of the best universities here in Latin America. And also by the system of health, we have public and private. What does that mean? It isn't like the US that you have like all just a big system of health, like different. If you don't have your payment of your secure is different. But here in Costa Rica, we have public and private. What does that mean to all the people who is watching and listening us? In the public side of our health it's called social security, is one of the top systems in Latin America, because when you get your payment, everyone gets their cut of the social security. That means that every citizen of Costa Rica is paying your attention. So the system of the health is financed by every person. So we have like three main public hospitals, and we have a lot of work because that kind of attention is for all the people from the coasts, the people from the poor sides, because we are a country that isn't a rich country, and we have to fight poverty. And in the public side, we help people who can't pay a surgery, who can't pay a chemo, who can't pay a radiotherapy. And because it's like equal to all. And in the other side, we have the private sector in which you get paid much more money for attending the patients, and you have the patients that can pay. So I work in both sides. I don't like to just go in private, because in the social security is the part where you help people who doesn't have the resources. People don't have the resources to pay a surgery of any kind of money. So they are just attending our social security system. And if you watch the statistics of Costa Rica, we are in the top 5 of Latin America of our public system of health. All the foreigners always tell me like, oh my God, here in Costa Rica, you have a lot of things. You are like privileged in that kind of attention. But for me, I will never leave the public attention, because that's where you can give back, not just be there for a payment or something. It's just like the feeling of helping. For example, people from the coasts, who really people who don't have access to any kind of health system. That's the side of our health system where I can help all kind of people. So that's an important distinction that you can get, and everyone who is watching us, because there's that human side that we can never leave.
Yeah. Well, we love that because we see that here. It's not our setup is not quite the same, but there's a public where people can go in Costa Rica, and that is beautiful. And to know that a physician like yourself is there to service them,
Yeah.
you're one of the top surgeons there in Costa Rica. So to be able to have you on their team, what a privilege. And then the compassion and being able to text them, Dr. Jimenez, it's important, right? Because a lot of times this is what we consider the holistic approach, right? I mean,
Yeah.
being able to treat the whole person, not
Yeah.
just giving them the surgery. And hearing you, it's refreshing. It really brings joy to know that you are a physician that cares. You are a physician that will go the extra mile, take your time, pause the things that you're doing to check on the individual. And those things don't go unnoticed. And it's important. And that's also why you're one of the best there in Costa Rica. So thank you. Thank you for that. And I say that for all the patients that you see. Thank you for that.
And I want to thank you for taking your time, Kenny, in this beautiful podcast and going the way All Talk Oncology means, that how we can help each other. So I want to tell all the ones who are listening and watching us, you aren't alone in the diagnosis of cancer. You won't be alone, for example. And in my case, if you come here to Costa Rica and get your treatment, you will like make all the tourism of our beautiful, amazing Caribbean side and Pacific side, our beaches, our volcanoes and everything. We are one of the top tourism countries worldwide, and you can get all that beautiful experience of going everywhere and also get your treatment, but with the integral point of attention. It's not just like getting that surgery great, it's also of getting by the side of your patient. And in this issue, I had just 2 weeks ago, I made a surgery of a French little guy. He had 12 years old. He had appendicitis. They were here in tourism in the mountains of our place, and they were making canopy and everything. They were just excited. And then he was called Muhammad. Muhammad started with, and always the mother, we have to go to the doctor. They went to a doctor right there in a far side of Costa Rica, of the capital, and they made an ultrasound. And ultrasound showed nothing. And they were like, oh my God, maybe it's nothing. But then Muhammad started feeling worse and worse and worse. And the emergencyologist called me because they were then in San Jose. And when I touched him, I knew he had appendicitis. It was part of I also make general surgery. And I told him, don't worry, everything will be all right. And I sent the message to the father later after surgery. They lived in France. And he told me like, doctor, thanks a lot, because in France, we just have like the best ORs. We have robotic surgery. We have top surgery. But what's the deal of having the best facilities and not having a surgeon that can explain me just as easy as you are? I made a drawing. I explained the appendix is this thing and everything. And I texted him, and they were so happy. Then he sent me the picture of Muhammad when they went on the ship back to Morocco and France. And he told me, doctor, thank you, because as a parent, you're afraid. Oh my God, what's going to happen with my little kid? And that feeling of just giving the number, Kenny, of just being there, of just saying the father and mother of Muhammad, this is what is going to happen. This is what we're going to make. They told me, man, in France, we have the best technology, but they're cold. They're just cold. Here in Costa Rica, when you got here, you could meet everyone here. They're just like, we like hugging, we like giving the hand and everything. And I like personally to give that extra mile. That concept for the parent, it was just great. It's the same in oncology. It's exactly the same. In my practice of my medicine, I have to give that extra mile. I have to hug you. I have to cry with you. I have to be with you. Because, Kenny, another topic that I wanted to talk to you about was what happens when I get home. Remember what we were speaking about? What happens with that? Also, you work with oncologic patients. You know how is that feeling. You can't just unplug yourself. Kenny, we aren't machines. We aren't like just machines that get unplugged, like you unplug your iPad and your iPhone. No, man, you can't do that. You carry your thoughts about your patients. You carry that feeling is that I made my best effort, and you are thinking about the mother, about the father, about the patient. You know how is that feeling, because I'm sure that you have experienced that, right?
For sure.
Yeah.
For sure. It's the human side, but
Yeah.
it's also, Dr. Jimenez, is what makes you one of the best. And I say that repeatedly because when someone is going through probably one of the darkest periods in their life,
Yeah.
and the most fearful, vulnerable time they may ever experience, you need someone that is warm, inviting, loving, humble, that can guide you, that can
Yeah.
reassure you, and not with false hope, right? I'm not
Yeah.
talking about reassure you with false, but just reassure you that we're going to work with you to get you through this process. And that's when you become that light to that person in their darkest period. And, you know, it is a gift. It's a lost art. It's a lost art because look at the times we live in. Everything is
Yeah.
rush. Everything is,
Everything.
we got to get this going. And you know what? The next patient, and it's a dollar sign for a lot of people. And it's that. And if you lose, we understand things are a business, and you understand
Yeah.
that there's a business side to this, but we're talking about the human side, and
Yeah. And
to be
yeah.
able to be balanced in both. And that's who you are, because I'm listening to you. You're balanced in both. And, you know, the patient, what a benefit you are and a blessing you are to the people of Costa Rica. So thank you. Thank you for that. And if you're wondering, where can you find Dr. Jose Jimenez? Listen, Dr. Jose Jimenez is in the Clinica Biblica in San Jose. Okay. That is a hospital there that you can look
Yeah.
up. Okay. It's a Clinica Biblica in San Jose. That's where you'll find Dr. Jimenez, surgical team. I think you got a whole team behind you too, right? That's not
Yeah,
right.
yeah, Kenny, because one of the main parts in oncology is that we aren't gods in oncology. I always tell my patients, oncology is like this hand. On medical oncologists, chemotherapy, radiotherapist, oncologists. We have the radiologists, we have the psychologists, we have the nutritionists, and we have the surgeons. So when our team contact a patient, our team is divided, and you have to attend to all your parts. I'm just one of that part, because we have to work together. If you aren't fine in your mindset and in your mental health, you can't get the surgery. So I have to work with the psychologist. The psychologist with a subspecialty in oncology, because I've always think that the professionals that work in oncology can't be normal professionals, man. We have to be one step forward. We have to be 1 mile plus. For example, I've studied 7 years of residency. First my general surgery, and then my oncologic surgery. And it's fun that side, Kenny, because when I was just a general surgeon, I had a different, mindset of cancer. And then I studied oncologic surgery, 3 more years for my fellowship. And I had like that change in my mind, Kenny. It wasn't the same Jose Pablo. I was a different person. The way I felt about my patients, the way I looked my patients, and the way I treated my patients. And then I got my whole team. When we speak in our team, we like to speak like an integral point of view, and we like to always talk the same. For example, I have a problem with my psychologist because sometimes she spends 2 hours of consult and she has all the patients, and I'm like, Adri, you have to work faster. We have a lot of patients here. And she tells me, I can't. I just have to continue speaking with them. And I'm also very, very similar. It happens also to me when I'm in a consult. Maybe I like 30 minutes, and the secretary is, doctor, you seated that patient, and you have another more. I just can't, because I'm speaking with the patient, and that is one of the parts that sometimes difficult for us, because we are too much getting in touch with our patients, and we like that. We like giving that extra mile that I'm telling you. And one of the most difficult challenges that I had, Kenny, is that when I started in the private sector, when you have to say to the patient, it's this kind of money, it's this amount of money, it was like, oh my God, how can I do this if I just want to help my patients? So it was like the most difficult part, like saying to the patient, is this amount of money? And because you feel like awkward feeling, how am I gonna charge you for that? It's what I love. But then you get used to it. And then that's the one thing you said, it's not a billing. Sometimes I know person that see that person walk, and I have colleagues that say how much he's the owner of that, he's, that, and you can't visualize the persons for the money. They are persons, man. And that's why you can never lose your humbleness. You can never lose the way of loving each other, because if you don't have love, you're lost. I think that one of the main problems in the worldwide, in our society, is that we have lost love. We have lost love for each other. We have lost that. If we lose love for each other, we are hateful person, full of anger, full of hate. You walk in the streets, people, their cars hitting each other, people running by the streets. People are full of hate nowadays, Kenny. And you watch social media projecting images of people who aren't by themselves. You have to keep your self-love and your humbleness and your way of being always. Don't lose that love. That's why when I spoke to you, I don't want to speak about getting a mammography and an ultrasound from since the 40 years old, and your colonoscopy from 50 years old, and how do you make a right colectomy. No, I don't want to make that emphasis in your show when we spoke. I want to tell people a different things that make you be better persons right now.
For sure. Well, we appreciate you, Dr. Jimenez, for being able to show the human side
Thank you. Thank you.
of your profession. We appreciate that you cater to your patients even in a place where it is private and it's public, and you give them the same love and the same treatment. And so we thank you for that. And before we let you go, Dr. Jimenez, is there anything that you would like the listeners to know before we let you go?
Yeah, first the beginning, thank you, Kenny, and all your staff for your invitation. And for me, the main message that I would like to leave is you aren't alone in your diagnosis. For me, the best part of being an oncologic surgeon is helping the patient, is giving a hug, is giving a smile, is just, I'm here with you. And if you feel lost, if you feel like I'm gonna die, I wanna tell you, I've also felt that feeling a lot of times in my life. I'm not perfect. We doctors aren't bats. We are just normal persons who have hands. We are just normal persons that try to make our best effort for our patient. I give my extra mile every day. And I would like that all the people have that impression about me and our oncological practice. We are persons beside that white coat. We have a family. We have a pet. We have things to do. We carry stress. We watch games. We love making things also like every normal person. And I know that the people carry the hope in us. And I feel the privilege of that. But we are just making our best effort for you. So, Kenny, the main message is always don't lose your faith. Don't lose your hope. We will be there for you. We will carry for you. I will be there. And in other time, maybe we can talk about that point of view of the psychologist part, because I love that issue of psychologists. When I always with my psychologist, I tell her I love the way you do. And that's the main thing. Don't lose your faith. Don't lose your hope. We will be there. Differently from your different, if you believe in God, if you believe in Christian, in your Judaism, whatever you are, don't lose your faith, don't lose your hope, and we will be there. I will be there for you. Thanks a lot. It's a privilege for me to be invited to the show. And again, the holistic point of attention. That's our main goal of attention for all the patients.
We love it. We love it. Clinica Biblica in San Jose, Costa Rica. Listen, make sure you look up Dr. Jimenez. He's the man who's going to be there to take care of you and walk you through this journey. And it is a privilege that we have you on our show and being able to demonstrate your true passion and compassion for your patients. And we can definitely take notes on that and be better and incorporate that into our practice and in our lives. And as I tell our patients all the time, we hope that you benefited from this, because Dr. Jimenez was dropping lots of gems that you can benefit from. But most important, as we always say, you're not alone in this.
Yeah.
We're in this together. This is Kenny Perkins, aka your cancer guy. And until again, I'm out.
So stay connected with us on All Talk Oncology Cancer Podcast. Make sure you subscribe to that, right? Wherever you listen to your podcast, whether that's Apple, Spotify, make sure you subscribe and continue to spread that word, right? Engage in this, because your engagement can help someone stay alive. And this is what we're talking about. So again, make sure you subscribe, hit that subscribe button. Again, this is Kenny Perkins, aka your cancer guy. Until again, I'm out.